first lecture in our series on drug delivery will be an introduction to the current state of drug delivery and perhaps the needs, identifying the need for improvement in this particular area. In terms of the learning outcomes, it will be important for you to be able to compare the traditional drug delivery routes, discussing the advantages and disadvantages of each. So this is something we'll cover in the first lecture. The second lecture will be mainly concerned with transdermal drug delivery, and you will have to critically discuss two novel methods of transdermal drug delivery, comparing advantages and disadvantages of each. After that, we'll be talking about essentially polymers and nanomedicines. So in particular, we'll be discussing things like cyclodextrins, polymeric micelles, hydrogels, liposomes and dendrimers, and it's important for you to be able to critically discuss how these novel methods improve on the current drug delivery methods, but also how they compare to each other as well, and being able to give advantages and disadvantages of each. I suppose one of the first places we should start really is with drug absorption, and just to have a kind of a recap of what happens during drug absorption. So bioavailability is defined as the rate and the extent of an active agent is absorbed and becomes available at the site of action, giving a therapeutic response. And for this to happen, we need the molecules, the drug molecules, to be able to pass through or pass between cells, biological membranes, to make it into perhaps the systemic circulation and to reach the site of where it's actually needed. This depends a lot on the process of absorption, and there are different ways in which drugs can be absorbed. We have paracellular diffusion, or passive diffusion as it's sometimes called, transcellular diffusion, which can be active and passive and be with or without a concentration gradient, and also endocytosis. The typical barriers that drug molecules encounter would be things like mucus, epithelial cells and cell junctions. If you take a look at the diagram on the right, it illustrates some of these processes by which drugs can be absorbed, and in this particular instance we're looking at the gastrointestinal tract, which is probably one of the major routes for oral drug absorption. In the compartment called apical or A side, this is typically the lumen in the case of the gastrointestinal tract, and the epithelial cells, which are the epithelial cell layer, which is only one cell thick, regulates the movement of molecules in and out of the cell, but also passing through to the other side, the basolateral or B side. And the basolateral side is generally representative of things like blood vessels, which can then take away the drug molecules to the systemic circulation. There's also biochemical barriers, which include things like enzymes, degradative enzymes, either proteases or the cytochrome P450 enzymes, which we've discussed previously. In addition to that, there's also efflux systems, which we'll talk about later. These include things like glycoproteins, P-glycoprotein, multi-drug resistant proteins. As mentioned already, this very often takes place with or without, in some cases, a concentration gradient, meaning that if it's with a concentration gradient, the drug is usually moving from an area of high concentration to an area of low concentration, and this tends to be the case with absorption through the gastrointestinal tract. In order to be absorbed efficiently, we need to consider some of the drug properties, the physicochemical drug properties, and the ones listed here on the slides are probably some of the most important, in particular things like lipid solubility. It is obviously important for the drug to be able to cross these biological membranes, but of course these biological membranes are made of lipid bilayers, and therefore they need to have some bit of lipid solubility. This can be measured by the partition coefficient or the oil-water partition coefficient. It's sometimes maybe necessary to modify drug structure or to have a prodrug of some kind that then might get cleaved or modified in a certain way chemically later on in the body's organs. The ionization state is very much dependent on the pH of the surrounding environment. Some molecules will ionize at low pH, others will ionize at higher pHs, and generally speaking, the unionized form of the drug is the one that is absorbed the best. So this needs to be considered when thinking about where does the drug need to be absorbed and what's the site of action. The molecular weight and the volume, or the molecular volume, is also important, because low molecular volume generally means higher diffusivity. It's quite difficult for cells to take up large molecules. It's much easier for them to take up smaller molecules, not only in weight but also in the area and volume in which they occupy. The aqueous solubility refers to its solubility in water. We've already mentioned lipid solubility, but in a lot of cases drugs must be in a solution before they can cross the epithelia, and this will require some chemical modifications. Finally, the chemical stability refers to whether or not they're easily degraded or easily modified by degradative enzymes, by processes such as oxidation or hydrolysis, for example. When thinking about how drugs are actually administered, most people would think of the oral route as being the most common. However, there's many other ways in which drugs can be administered. When we think about the ideal administration route for a drug that's under question, it's important to think about things like the surface area, its contact time, the metabolic activity of the surrounding environment, an adequate blood supply, its accessibility of this particular route, the lack of variability, the permeability of that particular route, and whether or not there are any clearance mechanisms. So as we talk through some of the major routes of drug administration, we will try and address some of these different facets of the ideal administration route. The traditional routes are as listed below and outlined in the diagram. As most people would know, oral is probably one of the most common routes used, particularly for tablets for systemic use. But there's also methods like the oral transmucosal route, whereby dissolving forms of medications get taken by the oral route, but rather than being swallowed and going into the GIT, they can actually be taken across the epithelial cells of the gums or the mouth or under the tongue, for example. Nasal is usually for local action. These might include things like agents for removing mucus in the nose, for example. Pulmonary delivery can be for local use, but also for systemic action as well. I suppose the best example of these would be inhalers or nebulizers. Ocular drops definitely are for local action and pertain to the eye only. Transdermal patches are for systemic use, and we'll discuss those in more detail in the next lecture. Rectal suppositories are mostly for local action. Vaginal creams would be the same, and intrauterine devices. And finally, injections would be for systemic use. The first of the routes that we mentioned there, oral, most commonly would be things like tablets, capsules, but also liquid forms like suspensions and emulsions. The majority of drugs given by this route would be absorbed within 1 to 3 hours. The factors which are important to consider for this particular route would be things like the motility of the gastrointestinal tract, the blood flow, in particular the splanchnic blood flow, the particle size and the physicochemical properties of the drug itself, the tablet, the pH, because as we've discussed previously, The pH of the gastrointestinal tract varies from the mouth all the way down to the colon. Whether or not food has been taken with the medication, gastric emptying can change as a result of food being present. Food can also bind, some components of food can bind medications. The metabolism within the gut fluids, the microvilli, and also the bacteria, the gut microbiota, can have a big role in terms of metabolites that are generated. Finally, mucus is most definitely one of the stronger physical barriers to diffusion, and it can be difficult in some parts of the gastrointestinal tract for drugs to be absorbed because of this physical layer of mucus. Common examples of oral drugs include things like aspirin. The oral transmucosal route refers to sublingual, which is under the tongue, and buccal delivery, which would be around the gums. Shown in the diagram is are both of these routes, referring to or identifying things like the sublingual gland, some submandibular duct, and also the parotid gland as well. In the layers of cells under the tongue and also on the gums, there's a number of epithelial cell layers, as indicated by the diagram on the right, bottom right, beneath which there are capillaries where the drug can actually enter into the systemic circulation. Freeze-dried dissolving forms and patches as well, oral patches, can be used to deliver some medications, particularly for things like dentistry, but also for drugs of abuse as well. Drugs like cocaine or fentanyl as well can be rubbed on the gums and be absorbed by this route. The factors for consideration here would obviously be the epithelial permeability and the thickness that the drug would be able to make its way through the different layers of epithelium. Also the oral enzymatic activity. There are a number of enzymes that are constituent in saliva, and the saliva and actual mucus clearance can have an effect in terms of the residence time, how much time the medication has in contact with the epithelial cells of the gum. Drugs for treatment of conditions of the oral cavity would be the most common use, things like periodontal disease and fungal infections, but also, as we said already, numbing pain with drugs like fentanyl or cocaine or dental drugs as well. Nasal delivery tends to be in the form of nasal sprays or drops. These would include things like decongestants, antibiotics for infections, and mucolytics to break up mucus and ease breathing. The nasal surface area is quite large and has a good blood supply. It is regularly cleared, the mucus is regularly cleared by a particular mechanism of mucociliary clearance, and drug absorption is affected by the state of the nasal cavity, enzymatic activity as well, and immune clearance, and of course the build-up of mucus as well. So shown on the right hand side, the diagram indicates the areas we're talking about, particularly around the sinus and nose, which has a layer of columnar epithelial cells, beneath which there is a layer of blood vessels and the lamina propria, which is where a lot of immune cells might be resident. So it is often used as a route for things like a clearing of colds and flus, for example, and coughs. Pulmonary delivery is primarily used to treat airway conditions and for the delivery of volatile anesthetics prior to surgery. These can be in the form of aerosols, where very fine and small particles are nebulized and inhaled by the subject, either through a mask or through a nebulizer or inhaler. In particular, factors such as particle size and particle deposition will play a role on where the drug actually ends up, either in the bronchi, the bronchioli, or if it needs to reach the alveoli at the very end of the breathing airway pathway. One of the things that can play a significant role in this is breathing patterns, breathing volumes, in particular tidal volumes, mucus, the presence of mucus in the lungs, and how quickly or regularly it's cleared. Shown on the right is the different areas of the lungs, and in particular, please take note of the size of the epithelial cells along this route. You'll notice that the epithelial cells, in particular in the bronchi, are much larger compared to those not only in the bronchioles but also in the alveoli as well, which are extremely thin. They're obviously thin because you need to have good exchange of gases with the blood supply, the capillaries, in order for us to breathe in and to breathe out things like oxygen and carbon dioxide in particular. Some of the drugs that are delivered by this route include things like inhalers for asthma, like salbutamol or beclomethasone, and as we said already, the volatile anesthetics such as halothen. Ocular delivery is, as said already, for local treatment, meaning things like eye infections or glaucoma, and this will tend to be in the form of eye drops. However, there are now other routes by which drugs can be delivered to the eyes, such as intravitreal, which means into the vitreous humour with a needle, and subretinal injections as well. The retina indicated on the diagram in the top right, where a needle is inserted to the back of the eye in an area under the retina. This form of delivery can very much depend on the drainage of water or tears from the eye, the nasolacrimal drainage, the pH and surface tension of those tears, and how hypotonic it is, because hypotonicity can affect the permeability of drugs if it's in the form of an eye drop. Examples of drugs that can be delivered this way include things like dorzolamide, timolol, which are drugs for glaucoma. Shown on the bottom right hand side is the stroma of the eye with epithelial cells and endothelial cells. It can often be a requirement for drugs to make their way through several different layers of cells before actually reaching their intended target of either the cornea or the different anterior and posterior chambers of the aqueous humour. Transdermal delivery, again, we'll discuss this in a lot more detail in the next lecture, but this can take the form of things like patches and iontophoresis, which is an electrically stimulated form of drug delivery. The main factor that's controlling this would be things like the stratum corneum, or the uppermost layer of the skin called the epidermis. This will depend, of course, as well on the anatomic site. Putting patches on your arm versus patches on the soles of your feet can be quite different in terms of the extent to which drug gets absorbed because of the thickness of those uppermost layers. The health and or disease state of the skin will determine as well the degree of absorption. In particular, aging has an effect on this. Drugs can also be metabolized in the skin. There are certain P450 enzymes that are expressed in these regions, and if skin is shed or renewed, inflamed with some kind of a sensitizer, this can also affect the degree to which drugs can be absorbed in these locations. Probably the most famous examples of patch systems or transdermal delivery would be the patches used for nicotine, for estrogen as a contraceptive, and fentanyl patches as well for pain. For rectal delivery, it's generally in the form of a suppository, which is a tablet that dissolves over time. This can often be used to treat gastrointestinal conditions, or can be used for systemic delivery as well. This might be things like laxatives, or for treating hemorrhoids as well, or as anti-inflammatories for the lower colon. In addition, though, it could be used as situations whereby oral delivery of drugs mightn't be feasible because of things like vomiting or obstruction of airway of the oral route, so it might be necessary to deliver drugs systemically via the suppository method. GI motility, of course, will have a role to play in this, and the blood flow in and around the lower colon, in particular particle size and pH, it will come into play in terms of the degree of absorption, whether or not there's a high presence of bacteria that can metabolize the drug, and if there's a layer of mucus that acts as a physical barrier to diffusion. Examples of drugs that are sometimes delivered this route include things like diclofenac, which is an anti-inflammatory, diazepam, which can often be used for systemic administration as well. Vaginal delivery is very often in the form of anti-infective creams or anti-inflammatory drugs. Sometimes it can be used to deliver things like hormones and spermicidal agents as well. However, the delivery via this route will be dependent on cyclical changes. In particular, the menstrual cycle will influence the thickness of the cell layers that are needed to pass through before full absorption occurs. Fluids in the area as well can play a role in the degree of absorption, as well as pH, enzymatic activity as well. Some examples of drugs that can be delivered this route are obviously estrogen, progesterone hormones, but also things like anti-infectives like metronidazole, which is an antifungal cream. The injection route will typically be things like subcutaneous under the skin, intramuscular, and intravenous as well, which would probably be the most common. In addition to that, certain drugs need to be administered via the spinal cord, and this is known as intrathecal or IT injection. So one of the, I suppose, the main goals of drug delivery and drug delivery systems is to not to create new drugs, but to improve existing drugs and to improve things like their pharmacokinetic profiles. Also to make them more cost effective and more convenient for patients to take, and also to increase the compliance for patients to take these drugs. And finally, probably the most important thing would be to make the drug safer for the patient and to reduce the side effect profile. One ways in which we can increase drug absorption is to manipulate the actual structure or formula of the drug, and these include things like changing the lipid solubility, its molecular weight, altering its aqueous solubility or chemical stability long term. We can also change the formulation of the drug by adding things like penetration enhancers, which improve the passage of the drug across biological membranes. Mucoadhesives and enzyme inhibitors are also useful as well for bypassing physical barriers of mucus and the biochemical degradation by enzymes. One thing that has emerged in recent years is the changing formulation of tablets, in particular the idea of controlled release, that it's not something that is just a bolus and released all at once, but something that can be controlled to release a small amount of the drug regularly over time. Many tablets have been developed to do this, ones in particular that are enteric coated so that they don't get destroyed in the stomach, in the acid of the stomach, and can make their way further down the gastrointestinal tract where they might be needed. Things like anti-inflammatory drugs in particular, they might be needed in the colon, but might otherwise get destroyed in the acid of the stomach environment, can now be formulated with these enteric coated tablets. In addition, systems such as OROS, which is an osmotic controlled release delivery system, and things like geometric systems have now this multi-layered approach whereby a drug is formulated and put in. This formulation allows the drug in the center to be slowly released through a delivery orifice as indicated in the diagram in the bottom right, and the osmotic push layer will slowly release the drug rather than release it all at once. This gives a more desirable pharmacokinetic profile for these particular types of medications. The advantages of the controlled release system are that there's a reduced dose frequency needed, and that you can probably put more dose in the actual tablet, a higher dose in the tablet, and allow it to release slowly over time, thereby getting better patient compliance and convenience for the patient, reducing the gastrointestinal side effects of having a higher dose all at once, having less fluctuation in plasma levels as is indicated by the diagram on the right, where you have the blood concentration on the y-axis and the time on the x-axis. The old system shown in red is where you might have to take several doses over a number of hours, whereas the CR controlled release system in black gives you a nice release profile over time, and that remains in the effective therapy dose range rather than peaking and dropping to toxic, possibly side effect levels. This improves the efficacy to safety ratio, gives a more uniform drug target, and you can get by without using a really high total dose. So in summary, the lecture summarised that most drugs are absorbed via epithelia. Epithelial barriers prevent efficient absorption. That physicochemical drug properties affect absorption, and once absorbed, drugs can be eliminated quickly. Each route of administration carries its own unique barriers, and finally we discussed how controlled release methods overcome some of these problems with oral delivery in particular.